Good morning, good afternoon, and good evening, everyone. My name is Ben Choi from Go Physical Therapy. Today, we'll talk about the biggest mistakes during the rehab process, whether that's through an injury, a musculoskeletal issue, or a joint issue that may happen to everybody. I've seen a lot of these three mistakes being made, a lot of these three misconceptions being made, and so here in this video, I'm just going to address it and give you guys some knowledge. So let's go ahead and get into it. The first one on my list, which is probably the most common issue that I'll see when I see a patient coming in, whether they want to do their own rehab or whatnot, is that they target their own specific area. Say, for instance, I have a shoulder injury. My shoulder hurts. The front of my shoulder hurts. So they're just going to slam a lacrosse ball right on the front of the shoulder. Well, I'm sorry, but sometimes, or not sometimes, most of the time, a lot of the issues may come from more than just that specific area of pain. Whether that's through the muscle, referring pain into that area, maybe the neck has to involve with it in case of the shoulder, maybe the thoracic spine, the mid-back has something to do with the shoulder pain. And so when I see patients with a very specific area of pain, I often think to myself, well, if this person has this specific area of pain, where else can it come from? Maybe it comes from different points of the area. Maybe there might be actually something going on rather than a musculoskeletal issue. If there is some patterns going on, maybe there is some sort of heart condition, or maybe there is some sort of vascular condition that is causing the pain here. So looking at a very specific area may not help you as much, especially if you're just pointing that specific area. I would encourage everybody to look at different areas of the body and see if there's any weaknesses or any strengths or any imbalances that may happen on their body. The second thing that I always see with patients, especially with people who have chronic pain, who have a lot of chronic issues, is that they don't actually treat them right then and there. Yes, sometimes the body has pain. You know, if you worked out a super long workout, 3 hours, of course, you're going to have a little bit of soreness, muscle aches, maybe even some muscle joint pain and stuff like that. But besides that, if you actually have a legitimate injury or a legitimate pain that hasn't gone away in 3 years, it's best to actually see somebody for it. Otherwise, if you don't treat that right then and there, it can actually cause a lot more issues with the nervous system, being hyperactive with that pain, and a lot of issues maybe going down or going up the body. So for instance, if I have foot pain that has been there for 3 years, I best bet that I haven't been using this foot properly for 3 years and might be having some weaknesses in the knee or in the quads or the hamstrings or even in the hips, going up all the way to the lower back. And that's when you see a lot of patients with complex cases where they have pain the whole body and they don't know why. Maybe it started off with the foot, maybe it started off with their hand, and then all of a sudden their whole body gets flared up. The last one that I want to point out for a lot of the patients that I see is that they rely on Google to treat themselves at first. They don't go to a professional provider in order to treat them. Yes, Google is a very good search engine. You could find anything in there. You could find anywhere from cat videos all the way to medical conditions that might sound familiar with your own condition or with your own symptoms. Now, relying on Google can have a few benefits. One, you could see some immediate results on what is going on. Maybe there is some condition that you don't know exactly what's going on, but you want some information. But at the same time, you can be combined with different conditions that have no relation to what you have. And so if you have shoulder pain, Google might spit out, okay, you might have some tendonitis, you might have some adhesive capsulitis, you might actually have cancer. You might actually have a heart attack. You might have some sort of skin condition. And so it doesn't really describe and don't have any professional legitimacy in terms of treating you. And so what I recommend in terms of this point is that you will come to a clinic or come to a professional and actually see one of us or see one of the doctors and stuff like that and actually get a professional opinion. Now, yes, all doctors are not created equal. There are some doctors that are good and some doctors that are bad. And it's good for seeking second opinions or seeking third or fourth opinions to understand what your condition is. But Google is not necessarily the most professional way in which you can seek advice. All right, that is it, guys, for the video. All in all, what I'm trying to implement here is that ultimately injuries and conditions does need some professional advice, does need some sort of professional guidance. We're here, We learn for 7, 10, 12, 15 years in the industry, and we kind of know what's going on. Not saying that you guys don't know what's going on, but it's good to have some sort of unbiased third party, some other person being able to look at you and say, you have this, let's treat it by this way. And so if you're a person who has not really addressed your shoulder pain for 3 years, you've been trying to put a lacrosse ball in that very specific spot, you're using Google to try to help you find what spots to find, go ahead and see us, go ahead and see some other provider, some sort of doctor, in order to help you go through your injury. So if you have any questions, comments, or concerns, leave them down in the comment section below. If you like our video, please give us a thumbs up and subscribe. We got more videos coming soon. All right.